Welcome to our iMovie discussing Latino culture. Before we start, we would like to point out that Latino culture is very diverse. Latino culture includes many countries with their own very diverse cultures. However, this iMovie will attempt to highlight overarching themes likely to be relevant when interacting with these cultures as therapists. Some debate whether or not Spain is included in Latino culture. We'll leave that for you to decide. This is just a quick map to show the Latino population in the United States. As you can see, California, Nevada, Arizona, New Mexico, Texas, and Florida have the highest percentage of Latino population in the United States.
Understanding of Latino culture is important for healthcare professionals in the United States because roughly 54 million Latinos live in the United States. Making up 17% of the total United States population, it has become the U.S.'s largest ethnic minority. Also important to healthcare professionals, as many as 1 in 4 of the uninsured in the United States are Latino. Under the Affordable Care Act, 2.6 million Latinos aged 16 to 24 years who were previously uninsured acquired covering under the Affordable Care Act. A Latino patient may be more likely to have diabetes, tuberculosis, hypertension, HIV, alcoholism, cirrhosis, and death from violence. However, a Latino patient may also be less likely to have heart disease.
In Latino culture, medical attention is not sought until conditions become more serious and require immediate treatment. Use of traditional healers and folk medicine as primary line of defense is a proposed explanation for the abnormally high rate of acute health causes in persons of Latino culture. Another cultural idea contributing to the issue may be the Latino expectation to endure pain without complaint. Working in acute care, a physical therapist may be more likely to have patients with Latino heritage requiring Latino culture competence in particular. In addition, a cultural trend of keeping private life private may also be a contributing barrier.
Latino culture presents with a high value on formal interaction. This especially applies when working with a patient of more advanced age. In addition, familiarity in touch or use of first name may also be offensive to a patient of Latino heritage. Therefore, in formal conversation, a Latino patient or family will be less aggressive. If the patient or family disagrees with the physical therapist or other healthcare provider, he or she will respond with silence or non-compliance.
Another concern is family-centered decision-making. Latino culture is far more family and community-based than the individualized American culture. This difference may be seen when decisions are being made in relation to patient care. When working with a patient, family members present may require more attention from the physical therapist in the decision-making, prolonging treatment time. Gender roles are also very important and valued in Latino culture. A female family member may determine when medical attention is necessary, but the male head of house is responsible for determining whether the person really seeks that medical attention. A female patient may prefer that a male family member be present to ensure that she is getting the care she needs.
When it comes to religion, more than 90% of the Latino population in the world is Roman Catholic. Religion influences many aspects of life, including family and community affairs. In the United States, people of Latino culture make up 40% of the Catholic population. They believe that health is a gift from God, so to help prevent illness, people of Latino culture will visit shrines, light candles, and pray.
In Hispanic countries, there are often 4 meals a day: a breakfast, lunch, afternoon snack, and dinner. Lunch is considered to be the most important and biggest meal of the day, and is often followed by a rest period. On the other hand, dinner is often a small meal eaten late in the evening. Meals tend to be viewed as an important social event and are often very family-oriented. Contrary to common belief, tacos and burritos are not popular food items in all Hispanic countries. They are primarily Mexican food items. In reality, Latino cuisine varies widely based on where you are. Examples of Latino food includes churros, tortillas, flan, burritos, gazpacho, which is a bread soup, and paella, which is a rice and meat-based dish.
Many popular dances today that are associated with Latino culture were largely developed in social spheres in an organized manner and with professional musicians providing the beat. Some types of dance that you might be familiar with are the samba, the rumba, the cha-cha-cha, the mamba, and the merengue. And these are just the tip of the iceberg. There are three distinct influences: the native influence, the upper-class European influence, and the African influence. The European influence brought a daintiness to the indigenous dances of Latin and South America because the steps were smaller and the movements were less forceful. Combining this with the appealing beat of the African drums is one of the defining features of Latin dance.